Yes, it is the final week of campaigning before the provincial election coming up on Thursday, June the 2nd. And we've been looking at key election issues, trying to break it down for anyone who is trying to figure out who they're going to be casting their ballot for on Thursday. Healthcare is our issue of the day today.
And based on polling, the number one issue for a lot of people in the province of Ontario. Let's break down where the parties stand here, starting with the Conservatives. They want to build hospitals, spend more than $40 billion on healthcare by expanding and renovating infrastructure projects over 10 years. Recruitment of nurses and retaining nurses. Up to 1,500 nurse graduates every year could have their full tuition reimbursed in exchange for practicing for 2 years in underserved communities. And a pledge to provide nurses a lump sum payment of $5,000.
Yeah, and with the NDP now, they want to make mental health part of OHIP, implementing a funded mental health care program by providing therapy and counseling services through OHIP. They also want to add an additional $130 million to reduce the wait list for children's mental health services to just 30 days.
Stephen Del Duca and the Liberals want to put $1 billion over 2 years towards clearing surgical backlog, put additional funding into allowing hospitals to operate significantly above pre-pandemic volumes. They've also pledged to increase wages for healthcare workers, including a minimum of $25 an hour for PSWs.
With the Greens, they want to boost nursing enrollment as well. So they want to increase the enrollment numbers by about 10% a year for 7 years, boost nurse practitioners by 50% by 2030. That target is about 30,000 more nurses.
And Bill 124, which caps the amount of pay increases for front care healthcare workers in English and other public sector workers. The NDP and the Liberals and the Greens want to repeal it. The Conservatives, their stance is, look, we're going to reimburse nurses here, single amount. They have not spoken much about Bill 124. A lot of people have. I'll say this. Building hospitals is important. Expanding infrastructure is important. You need people in the hospitals to care for people, okay? This is part of the discussion that gets lost a little bit. It is important to reinforce the point. If you don't have people to work the hospitals, building the hospitals doesn't matter.
Yeah.
And I'll leave it at that. The election, again, is this week. It's amazing. Thursday, June the 2nd, it has arrived.
Goes quick,
It goes quick. The heat wave will go quick. It'll be around for a little bit, though. Frankie, good morning.